All right, we are a nation of pill poppers. 46% of Americans are regularly taking a prescription medication. I count myself among them, obviously my mother. Plenty of other people as well. I just kind of wonder how much of this is maybe us thinking we need a pill when we don't, being overprescribed, but how much of it is just the fact that we are getting older all the time? Our population is aging, and you don't get to 90 years old without popping some pills. Dr. Omar Durani joins us with Diamond Physicians. What's the cause of so many prescription medications, do you think?
Hi, good morning. Yeah, it's actually a combination probably of everything you had just stated. The increasing population, number one. And number two, it is an aging population, with the baby boomers getting to a point where the geriatric stage of life, there's going to be a lot of comorbidities, a lot of chronic health issues. And hand in hand, that's going to require a lot of medications. But at the same time, one of the things we have to really think about, and you touched upon that, is the overprescription of medications. And that's somewhat of a reflection of our health system, and that's a whole other topic in and of itself. But the reactive medicine, when people go in to go see the doctor after they feel ill or when they get sick, or a patient having 7 to 8 specialists involved, you're going to start getting a lot of prescriptions stacked up.
Seems to me, though, we were talking about younger adolescents. The greatest prescription use is ADD medications. Middle-aged folks, anxiety relievers. Some of this seems incredibly not so much to do with your physical health, but your mental health. And is that also being overprescribed?
No doubt about it. It's not shocking that we're seeing the prescription drugs kind of vary by the stages of life. And according to the study, almost 46% of, or half of Americans being on prescriptions. If you look at young children, it's mainly antibiotics, or it could be treatment for asthma. And then the adolescents and young adults, a lot of it is ADD, ADHD, and also mental health when it comes to depression, anxiety. And I think a lot of that may be based on the mental health system and having lack of access to non-medicinal therapies. It is very expensive to go see a licensed therapist to get some counseling, or there's no time to do counseling, and so a lot of doctors and families have that pressure to get this treated, and prescriptions are being written left and right. So there is an aspect of overprescribing. I think one of the keys are going to be to improve and have a foundation of primary care and preventive care moving forward. You have to look at your physician, your doctor, and have that personalized relationship where we can see what medicines are not needed, or how can I remove certain medications and improve on a holistic approach. I think that's going to be key. But at the same time, patients living much longer, there are medicines that we know that can help improve quality of life and actually expand life and have it last longer.
Dr. Durani, we see, obviously, lots and lots of television commercials for specific drugs that they're trying to advertise. The president's calling for making sure that we know how much those drugs cost as a part of that advertising. But might that kind of slow down the requests that you folks get from the public at large once people find out how much it costs?
I think that's a good point. With the new law, when they start seeing a price of $1,500 for this medication, I'm going to probably start seeing patients not ask as much. I think that will have somewhat of an impact. There's a lot of confusion, and there's some gray area of how much my medications are going to cost. Deductibles are being applied, the manufacturer coupon rebate is highly complicated. Even as a physician, the process, there's multiple layers involved. It's never very transparent. So I think it's a good thing to start seeing the transparency, but we have to do a better job to provide that quality access to your primary care. I think that is the key to help, because when you have 7, 8 prescriptions, there's oftentimes medicines just get left on your medicine chart for years without really looking into, do you really need this medication?
Yeah, good point.
I think that's something we have to look into.
Right.
You have all our empathy, because you're facing a tidal wave, doctor, trying to get people to do what's right for their own health.
That's right. Dr. Durani, thanks for joining us. Dr. Omar Durani with Diamond Physicians here on Newsradio 740 KTRH.